In the previous lectures, we have seen that obesity is linked to the development of many non-communicable chronic diseases and lower respiratory tract infections as well. I have mentioned that obesity is correlated to the duration, severity, and transmission of respiratory diseases caused by influenza A virus. The 2009 swine flu pandemic was a turning point in the history of obesity research as well. Obesity was identified for the first time as a risk factor for severe outcome of H1N1 infection. In this video, we'll focus on COVID-19. The disease is caused by severe acute respiratory syndrome coronavirus 2. Although coronaviruses are not related to influenza viruses, both COVID-19 and influenza have many common features. In the following, we will examine how obesity affects the outcome of COVID-19. The first case of COVID-19 was identified in December 2019, and COVID-19 was declared as a pandemic in March of 2020. Despite this relatively short period, several research papers were published that identify obesity as a considerable risk factor for COVID-19. A systematic review of 75 studies was published in the Journal of Obesity Reviews. The authors found a strong relationship between being obese or overweight and the risks of hospitalization and needing treatment in intensive care units. The study includes 399,461 diagnosed patients in more than 10 countries in Asia, Europe, and North and South America. First, let's examine the association between obesity and the risk of testing positive for COVID-19. The chart shows the odds ratios of being tested positive for obese and normal weight individuals. Remarkably, 18 of the 20 quoted studies show that it is more likely that you will be tested positive for COVID-19 if you are obese. The highest odds ratio was found to be 2.9. The pooled analysis shows an odds ratio of 1.46. In other words, it is 46% more likely that you will be tested positive if you are obese. The next chart shows the association between individuals with obesity and the risk of hospitalization with COVID-19. All the 19 studies show a significantly higher prevalence of obese individuals among hospitalized patients compared to normal weight patients. The highest odds ratio was found to be over 7. The pooled analysis shows an odds ratio of 2.13. In other words, it is 113% more likely that you will be hospitalized with COVID-19 if you are obese. The following chart shows the association between individuals with obesity and the risk of being placed in intensive care unit due to COVID-19. 21 of the 22 quoted studies show a higher likeliness for individuals with obesity being admitted to the intensive care unit compared to normal weight people. The highest odds ratio was found to be 5.49. The pooled analysis showed an odds ratio of 1.74. It is 74% more likely that an obese patient will be admitted to the intensive care unit due to COVID-19 compared to a normal weight patient. In the meta-analysis of the association between obesity and COVID-19 mortality, data from 35 studies were used. The odds ratios range widely from 0.58 to 6.29. There were 2 additional studies as well, one from China and one from Nevada, that were not included. They showed exceptionally high odds ratios, 32.08 and 10.55 respectively. The pooled analysis showed an odds ratio of 1.48. Another study was conducted focusing on the association between obesity and COVID-19 mortality. A meta-analysis, including 14 studies with 403,535 participants, compared the COVID-19 mortality among normal weight and obese or overweight patients. 531 of 2,451 patients died who were obese or overweight, BMI of 25 or higher, while 1,701 deaths occurred among 24,056 patients with a body mass index below 25. The odds ratios between the two groups were found to be 3.68. In other words, it is 3.68 times more likely that obese or overweight people die from COVID-19 compared to normal weight individuals. The next slide shows the results of another systematic review of 33 studies with the participation of 45,650 patients from 9 countries. The odds of being hospitalized, admitted to intensive care unit, necessity of mechanical ventilation, and dying from COVID-19 is significantly higher among obese individuals compared to normal weight people. Although the data from the quoted studies are heterogeneous, the majority of these papers identify obesity as a risk factor for severe outcome of COVID-19. The pathogenesis of COVID-19 is similar to the pathogenesis of influenza. Already mentioned in the previous parts that in obese individuals, the excess body fat that lines the chest and occupies the abdomen limits the action of the respiratory muscles. Adipose tissue around the airways narrows down the luminal diameter of the airway, increases resistance. In obese individuals, these physical changes impair the efficiency of gas exchange. Obesity leads to a dysfunctional adipose tissue, resulting in an adipokine imbalance, ultimately causing a low-grade chronic inflammatory state. The right side of the chart shows the adipokine activities of an obese individual. Adiponectin is produced in decreased amounts in obese patients. The activated macrophages produce increased levels of interleukin-6, tumor necrosis factor alpha, and reactive oxygen species, which contribute to the chronic pro-inflammatory state associated with obesity. As a result, obesity is characterized by a state of a chronic, low-grade inflammation and altered responses to infection. Chronic adipose tissue inflammation associated with obesity is influencing the activity of the cells of innate and adaptive immunity. These changes are associated with a negative impact on chronic disease progression, immunity from infection, and vaccine efficacy in obese patients. Through these video lectures, my intention was to emphasize that obesity is linked to virtually all modern-day diseases. By achieving our weight loss goals and by adopting a physically active, healthy lifestyle, most of our modern-day civilization diseases can be prevented. Thank you for watching.